Hi, welcome to HIMS TV. My name is Dylan Yogendra. I'm the managing editor at HIMS EMEA. Today I'm really excited to have with me Monica Jones, the Chief Data Officer at Health Data Research UK. Monica, can you give us a quick update on what your role is and what it entails and your remit, please?
I am the Chief Data Officer for Health Data Research UK, the hub for cancer. I'm also Associate Director for HDR UK North. In the UK, we've sort of split it up into regions. And so it's really about sort of improving access to healthcare data for researchers and actually just improving the quality. And my background is very much in the NHS. I've been a CIO of an acute trust. And now this is a bit more of a sort of an academic role and drawing upon that sort of experience in order to be able to help others.
Brilliant. Thank you, Monica. And we're really excited to talk to you ahead of the HET event that's coming up quickly. So obviously, just to dive straight into things, really, healthcare systems around the world have found themselves under increasing pressure with the pandemic and COVID-19, obviously. I wonder if you could talk a little bit about cancer care, actually, and what barriers have been lifted in order to help treat patients with cancer, and what's achievable and what will need to be addressed in retrospect, please.
Yes, so we at DataCan sort of noticed when the first wave of the pandemic sort of happened that actually there was some changes in behaviour, both with cancer patients and with the whole sort of system really in the UK. And in particular, we noticed a significant drop off in referrals from primary care, from general practice into hospitals, around about sort of 70% sort of drop off around about sort of April, May time last year, and similar around sort of people attending for chemotherapy and other sort of treatment, and some of this was actually because they were shielding, because they'd been asked to do that. But also we would, get very much getting that anecdotal evidence that people were more afraid of getting COVID than they were of getting cancer. And so, we felt that it was really important at HDR UK to look in and to this in more detail, collect the evidence, and actually then use that as a call to action to NHS England and to the cancer sort of leadership in the UK to make sure that cancer services were not being affected adversely, and that actually we could find a way to have a safe environment, not only for people who had existing cancer, for them to get the best kind of prognosis and outcomes as possible, but actually for people to not be frightened about going to their GP or going to hospital with suspected cancer. So, that was really very much what we focused on. And we were able to do quite detailed sort of research, not only on sort of historical data and some modeling, but actually we realized that we needed real-time data. So we're talking sort of within a week of being able to see what the patterns were, because quite often we find that nationally available data, whilst it can be of very good quality because it's highly curated, can be months, if not years old, and that doesn't help you to react when you're in the middle of a global pandemic. So that is very much sort of what we were pushing forward. We were able to reach out to our network, and we were able to create a real-time sort of data network to look what was happening on the ground there and then, and to be able to inform sort of what needed to happen.
Yeah. Really interesting stuff there. I mean, can I just ask a follow-up question to that, actually, around the value of open data and open standards in particular, actually, and what opportunities and maybe challenges you've encountered when integrating that data to make it useful beyond organizational boundaries?
Yeah, I mean, it's something that we've been working on sort of within the UK, and in particular the region that I'm based in, which is Yorkshire and Humber. So NHS England a couple of years ago funded a local healthcare record exemplar program, the LICRA program, as it's fondly known, and Yorkshire and Humber was one of the successful applicants for that. So we've got a population of about 5.8 million people who live in our region. And what we wanted to do was create a longitudinal record that could actually join up the disparate 74 different organizations across our patch, including the hundreds of GP practices. So we used HL7 Fire predominantly as an open standard in order to create fire profiles for interoperability. We've also implemented sort of clinical terminology such as SNOMED CT and building on sort of, previous WHO classifications such as ICD-10 and actually also sort of started to stretch the boundaries around having a common data model using OpenEHR. So, we wouldn't have been able to succeed to connect those things up without having those interoperable standards and being able to do that. And I think, it's a great testament to colleagues both here in Yorkshire and Humber, but across the UK that actually people get it, that you can actually create both a longitudinal record for direct care, but you can also create a persistent data layer that we can put into trusted research environments, into a data arc, in order to be able to do population health management, be able to do quality improvement, and to actually have that huge evidence base of what's sort of happening. So you can't do it. You can't have quality without standards. And frankly, I don't think you can't join things up without using open healthcare standards.
Absolutely. And that's something we're learning, I think, over the last few months. I'm hearing this more and more. Is this an area in terms of maybe, interoperability and standards that's been accelerated throughout the pandemic, do you think? Or is this something, are these the kind of timeframes that we were going to be working towards anyway?
Oh, no, it's definitely been accelerated. I think, digital transformation has been accelerated because of the pandemic. Those of us who have been in this business a long time have actually been, banging this drum for quite some time. And, and sometimes it fell on deaf ears because people just couldn't see the immediate value, and they couldn't see what it was in it for them. As soon as you have your workforce working remotely, in particular those people who are actually doing sort of detailed analytics on healthcare data, then actually it suddenly comes to the fore, and you get those real kind of penny drop moments when people go, oh, right, that's what it was all about. That's why it works, and that we can bring things together. Because frankly, everything that we are doing around sort of, understanding the sort of COVID-19 is population health management. It is very much about sort of understanding the characteristics of the cohorts, understanding who is going to fare better, looking at comorbidities, people with existing conditions, looking at the characteristics of your population, whether that's by sort of sex, whether that's by age, whether that's by ethnic category, all of those things. You need to have large, rich, well-curated data sets together to understand it, and you can't do that unless it's standardized. So yeah, it's been absolutely accelerated, and I think that is, one of the huge sort of, positive things that's come out of this whole situation.
Absolutely. And just to slightly move focus a little bit, Monica, can you talk a little bit about the patient voice and the value of the patient voice when it comes to data and their rights as well, please?
Yeah, no, I mean, it's absolutely important to have trust and public trust. There's plenty of fake news around, and actually, people are very happy to share their data with legitimate organizations and want to be able to to participate in that. So we at DataCan have, an absolutely sort of, core principle that we have patient representation on every single level, from our steering group all the way down to our working groups. And we have when you're working sort of in an environment sort of with cancer data, then, you know, there are plenty of people who have had cancer or are still living with it or have been carers, and they're very motivated to be part of the you know, improving the system. And what we find is that actually by everything we do, we run past our patient sort of representatives, and it gives us it creates good challenge, because it really makes you think, you know, is this the right thing to do? Even if we're doing everything completely legally, if we haven't got that public and patient trust, we won't do it. And I think that's really, really important. And it also just gives it the gravitas as well, that actually this is, you know, this is the right thing to do. And you know, it's not that difficult to do. People tend to avoid it because they think, oh, well, we know best. And, you know, those patients and public, you know, sort of don't know about it. But frankly, we're all patients and publics at some stage in our life, and you know, we should absolutely be involved in that. And there's been some great collaborative sort of work that has come out of our analysis and other setups as well.
That's so encouraging. I think it can sometimes be overseen how important it is to have the patient at the centre, obviously. I'm glad to hear that you guys seem to be going in the right direction as well on that front. Just in the interest of time, Monica, I wonder if we can address if there are any regions or countries that you think we should be looking to learn from, and what you think will be sticking in a post-pandemic world. I know you touched on the interoperability piece and how we've accelerated on that front. Is there anything else that you'd like to share with our audience ahead of your session at HET?
Well, I think the UK is well placed, but it's good to look more broadly. So certainly another piece of work that we've been doing through DataCan, and in particular through our scientific lead, Professor Mark Lawler, is actually working sort of across Europe on a pan-Europe 7-stage plan for the recovery of COVID and cancer services. And you know, that was agreed and published towards the back end of last year. And I think that was working with colleagues in the Netherlands, in Germany in particular, but across sort of Europe, to say, look, this isn't something that's affecting one country. It's actually something that you know, we should all be doing together. And so I think that's a really positive thing to actually collaboratively come together. And so that in particular I would direct people to, and there's details on our website around that 7-stage plan.
Fantastic. I'd like to take this opportunity to thank you again for your time, Monica. It's hugely appreciated. We look forward to learning more from you at the HET event coming up very soon. So thank you again, and we look forward to speaking to you soon.
Thank you very much indeed.